When to take this. I saw John, and now I'm inviting John Adler. All right. So thank you so much. I'm already inspired, and I have a couple of my takeaways, as I'm sure each of you do. But we continue our conversation on innovation. When take a seat, John. All right. So innovation actually changes the normal. What we call normal is a function of time. And just like we talked about biotech and drug delivery, now I'm so happy to be talking to this panel. And each of them has a story. John Adler is a professor of neurosurgery and his CEO of ZAP, and he'll tell you more. And we'll learn more as we engage in this conversation. Uh, Mickey has been a CSO, a CEO, and right now for many years as a consultant, he's worked with 150 plus startups and observed many of them very closely, including Evanosix, where he was on the scientific advisory board, and I ran it as the CTO. And now, and Neda will tell us how she became a CEO after being an investor, and we'll learn more about Isono. And Manoj is flown from India, and so what is algorithmic biologics mean, and what do they do? We'll learn more as we engage in that, and we'll see different flavors of innovation. And I thought it'll be good to focus on the two spots. One is just the genesis of an idea, and the second is the value of death. And those are my two things I feel that are crucial to any startup that has been successful. So John, why don't we start with you and tell us about your journey with CyberKnife and Zap, and how did it all begin? What was the inspiration for the idea, and how did you become sure that this is the right thing?
Well, I see myself very much, is this working? Okay, I see myself very much as a neurosurgeon. And I toiled in the trenches in the operating room and the clinics for much of my life, and that's my identity. As a neurosurgeon, you come to realize that we don't help far too many patients, and that's true in all of medicine. But it's not helping other people's patients, not helping my own patients. And so I was always mindful that it's humbling that you're not doing a better job. Drive a big car, your mother and father feel proud of you, but you're not helping your patients. So I was always a restless soul looking for ways to change. And so I very serendipitously did a fellowship at the Karolinska Institute, and with a charismatic neurosurgeon who created this field of radiosurgery. And I went from just being disgruntled or disappointed that I wasn't a better doctor to my patients to understanding that you can be a better doctor by changing the future of medicine. And so I, at a young age, I was 32 years old, decided that, seems young now, that was the future, my future, and the future of much of medicine. And so I pivoted hard from trying to just be a good doctor to trying to create the future of medicine. And have done mostly in the field of what we call stereotactic radiosurgery, which is a way of non-invasively, painlessly destroying brain tumors. And I advanced the field by making it possible anywhere in the body. And now at this last stage of my career, is that we've only scratched the surface. It's not just about ablating cancers and tumors, but that we can use this true force of nature to transform the nervous system almost like a drug in a very targeted way in the field of neuromodulation. So my roots as a neurosurgeon were critical to my path in life.
Cool. And being a neurosurgeon, you had very good understanding of the needs, but then you probably worked with engineers, you created a team. How did you bring it to fruition, the whole ZAP story?
I actually found the engineering to not be the hard part. I mean, conceptualizing um, how we might go about solving the problem was in some ways much more critical than the actual engineering tools to implement it. And I was not biophysics major. I had some knowledge of basic math and physics, um, but much more important was just kind of the resilience, the ability to just get pounded and pounded and pounded over decades. And I did have resilience. I was a wrestler as a young kid, and wrestlers aren't necessarily the best athletes, but they know how to take a pounding. And if you're good, you survive. So it's a lot like wrestling, The success to entrepreneurship is not being a genius and not having more money. It's really being the ability to not be defeated. If you're never defeated, you will win. And so it's not about winning; it's about not being defeated. So I was good at that game. So
Lovely.
not very smart.
Yeah. So this resilience theme, you cannot be an entrepreneur without resilience, is for sure. So awesome. Neda, you have been at Roche, Stanford, Illumina, then you were an investor before you became CEO at Isono Health. So how does this diverse experience help you do what you do? What do you do?
That's a great question. Can you being across different stage of product life cycle, technology and industries in the healthcare has helped me a lot to fully understand what are the shortcomings of the technologies and what are the shortcomings in the healthcare industry that prevents us providing the optimal cost, the optimal care. What I've observed throughout the time is the technologies, as Ashutosh just mentioned, I've been across therapeutics as well as devices and tech bio, and have seen how we care for patients in fragmented ways. A lot of time we are not overcoming the limitations of technologies, or the technologies are not overcoming the limitations of healthcare. So what I've noticed was there's a lot of things that could be done. Healthcare right now, we are encountering the raising cost of healthcare. If you notice, people talk about pharma cost of medication, but the healthcare itself, the services cost a lot because there is a lot of regulation involved. There is a lot of procedures involved that all cost the healthcare. The second problem we're facing in healthcare is shortage of skilled workers. A lot of time, as an industry, we need to think about how do we automate better? How do we reduce the need for skilled workers? How do we provide technologies that are interoperable? A lot of our technologies are working in silos. We don't address the challenges of the healthcare industry. Also, if you notice, there's a big movement to moving care closer to homes and outside the inpatient care setting to save costs and also to create accessible and more equitable healthcare. So seeing all of the things I saw and also encountering how the technology limitations are encouraged me to invest in this company. I have invested in other companies. I am LPs with multiple funds. But in this company, I was impressed with how they have shrunk the technology, an ultrasound, 3D ultrasound, and made it automated so it does not need the sonographer to be at the site of care. And also decoupled the technology, integrated with a PACS system for the radiologist, and allowed the access closer to home. I actually brought the device to show you how technology can be thinking outside the box and remove the need for a lot of steps in the health system that prevents access. Not only this reduces the cost, but also helps the health system as well as the patient to be able to get care when they need it. Right now, if you look at it, a woman goes to OBGYN or primary care physician for their annual visits. They are told, oh, you have to do your annual breast exam, come back, because we want to send you to a radiology center and do a mammography. Well, this back and forth prevents the woman from coming back. And by the time they come back, mammography, we know as a technology, is the X-ray technology and does not see through the dense breast tissue. So the technology also has shortcoming. The physician knows it, the radiologist knows it. They don't tell the woman. until the woman goes back and asks, okay, what are my rights? What do I not see? And this back and forth is providing insufficient care to the patient, and we have a lot of fall off in the whole spectrum. We, as a technology provider, all of us, we have to think about where are the areas of need and how our technology can address this lack of health equity and access, and also reduce costs for them.
All right. And will you tell us what is the, I don't know if everybody understood what is the Isono Health product. So
this is the product. We have shrunk the, if you have seen the if you've seen ultrasound, the card-based ultrasound with all the knobs, they can only be operated by a highly skilled sonographer. For breast ultrasound, you need additional advanced degree to be a breast sonographer. There is an additional skilled requirement. So shrinking the technology in a way that can be operated anywhere by any healthcare professional was the technology advancement that I thought would address a big unmet clinical need, as well as provide the best care for women at the place they need it. Although one other thing as an investor, you want the technology to be applicable to other areas. So seeing, some people call it platforms, some people call it multiple application. What I also like to see is a technology that can be applied in other areas and address bigger needs. What I can say is this technology attracted because of that.
Cool. All right. So Manoj, coming to you, your background in physics and math, and you was a professor at IIT Bombay. I say that because I'm an alumnus of IIT Bombay and I see many of them here. And then you left that and now founded this company, Algorithmic Biologics. What is it about and what made you move?
Thank you, Ashutosh. Very happy to be here. I did my PhD in California, but slightly south of here. I was at University of Southern California. So I don't have degrees in sort of physics and all these other fields, but I have had a somewhat unusual, I would say, academic career. So my undergrad was in computer science. I came here for a PhD in computer science, but I came to do my PhD in a field known as DNA computing or molecular computing. I thought I would be the theoretician in the group, writing down equations and writing code. But the very first week, my advisor kind of caught my collar and pushed me into the lab and said, go do that stuff. And he was kind of a big shot. He was the founder of the field of DNA computing. So his name is Len Edelman. He's the guy who is the A in RSA cryptography. So it was, and he just won the Turing Award a year before. So it was very hard to say no to him as a new graduate student. So I entered the lab, and the only thing I knew to cook at that time was tea. But somehow, working with DNA molecules is as easy as working with tea. It's not harder. Everything else is hard. RNA, proteins, everything's really messy. But DNA is easy, simple. So started working with DNA molecules, building DNA nanostructures, and the usual, sort of molecular biology people here, right? All the usual experimental stuff as a computer scientist. I had some beginner's luck. In my very first semester, my very first experiment worked. I got a JAX paper, and I thought, hey, I got this figured out. This is easy. But then for the rest of my PhD, nothing worked. So, so on the lab side, experiments are hard. And, I took it personally. I said, I'm not good at experiments. And so I'll stick to what I'm good at, which is math and computer science. So I did more of that stuff, but I remained in the field. I was fascinated by this opportunity to essentially build computers inside a test tube, computers that dissolve in water. That was what the field was about. And I sort of went deep into the field, a bit on the math side, bit on the, like more practical side, but away from the lab, staying away from the lab all the time. Yeah, a couple of faculty positions later, 20 years later, fast forward to the COVID pandemic. And when the COVID pandemic hit, everybody was struggling to get information about who was COVID positive, right? And then it hit me that it's not just that I am bad at experiments, the world is bad at experiments. Experiments are hard. It's hard to get information out of test tubes. And the second sort of shoe dropping was that I, in fact, have the solution to this problem. I have a set of tools, a way of thinking about this that can make a real difference to this problem. And so I would say that's how algorithmic biologics was born. The name itself, so biologics refers to molecules that are commonly appear in biology, so DNA, RNA, proteins. So we build algorithms in test tubes. And these algorithms help us pre-process information in test tubes before you measure things, making things much easier to measure from test tubes. So we are building scale efficiencies for molecular testing, and so that's what the company is about.
Yeah, make it even easier to understand. What does building scale efficiency for molecular testing?
So if I were to describe, one of the recent successes we have had in the lab in a POC experiment. So we could test 243 targets in 9 3-color PCR reactions. So essentially, we took a large number of nucleic acid targets, and we ran an assay that converted information from these large number of targets to a small number of downstream markers, so 27 markers. Then we measured these 27 markers in 9 PCR reactions. Then we ran a software that did the decoding to figure out which of those targets was present and how much. So this is one example of the kind of technology that we have built and the kind of, so applications are, so we are working with genomics labs, we are working with diagnostics companies. So it's still somewhat of a wide spectrum and multiple opportunities. In my head, we are building a new stack. We are building a coding decoding technology for molecular testing, compression decompression technology for molecular testing. And yeah, so we are looking at partnerships. We are also looking at service providers and providing them with solutions that will help them achieve scale efficiencies.
All right, Mickey, that brings me to you. You heard 3 stories and so many more. What are the common things that you've seen in startups that have gone on to do really well? How do they begin? Is there a, so I know it's a vague question, but basically what I'm trying to do is tap into your wisdom and experience, and what is the distillation that we carry?
Well, I think people who are most successful tend to be people that, I've talked about system 1 versus system 2 thinking with Daniel Kahneman. That really rings true to me. The people who are system 2 thinkers tend to be most successful. They're people who are going to very carefully think about what the opportunity is. They're going to truly try to understand what the unmet need is, what the product requirements are going to be. They do a target product profile. They're going to be very clear about what the studies are they're going to have to do, how much money they're going to have to raise. They do a great number of things and talk to a lot of people about what's necessary to actually change the practice of medicine. And that doesn't mean you're going to be successful, but it means you're going to have a much better chance of being successful. And I think people who do that take a long time before they pick up a pipette or a wrench to do something. They want to get the plan done right. And I remember Dwight Eisenhower once said, it's not the plan, it's the planning.
Okay.
Because the plan's going to be wrong, but the fact you did it, you're poised to change if you have to. So I think that's a very important part of all this. And I think that differentiates the success from the non-success.
Yeah, I love both. Successful, great processes don't guarantee great outcomes.
Right.
Bad processes ensure bad outcomes. So,
right. Yeah.
So therefore, I'm a stickler for good processes in that.
Yeah.
So
couldn't agree more.
So, all right, John, coming back to you, this whole, so this was the beginning I heard, but this whole value of death story for Zap, and what was that critical phase in your story with either CyberKnife or with Zap, where you thought that had one of the biggest bearings on the eventual outcome? Some decisions that you must have taken in that phase.
Yeah, well, it was, failure is what led to Zap. I made what I thought was a fantastic technology, and with the CyberKnife and Accuray, ends up treating millions of people. But the practical reality is no matter how many people we treated, we felt we were treating less than 1 in 10 patients. So something was not right. And I might add, many of those patients, increasingly numbers, are in developing countries like India, where we know they'd benefit from a superior technology. And I liken it to taking, a landline to the cell phone telephony. And I mean, developing countries, just when you put the right technology in the right environment, can just take off. So I've from a young age dedicated myself to this field, and I was failing to treat 9 out of 10 patients. So with that understanding, that failure, and the commitment to the field that led me to think, reimagine how we might do things differently, hopefully learning lessons from what I did wrong the first time. And then lastly, it was kind of willful ignorance and naivete, because I told myself, because I mean, startups are really, 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 really hard. I mean, I'm not gonna, and I've probably been more abused than anybody. I did not want to do another startup. I was just intimidated by it, and almost to the point of tears. I did not want to do a startup. So I told myself little lies that I could do this with a big company. And the fact is, big companies are just constitutionally incapable of doing anything truly imaginative and creative. I repeat, big companies are constitutionally unable to do real disruptive innovation. They can't. They cannot. Now, some days they can buy it. Sometimes they have the smarts to do it, but most of the time they cannot. But again, I was at this age, almost mid-50s, and I was still stupid. And I convinced myself that, no, this big company would do this with me. And in fact, I got all the board members talked to me, and all the management, and they told me how much they liked entrepreneurship and how they wanted some entrepreneurship in their company. And I was the right guy at the right time, and they had lots of money, and they needed my direction. A big fucking lie, okay? All organizations, they tell themselves these little lies, especially big companies, They have these big banners and all these, vision statements. They're all a pile of shit. So who does it? Well, but by that time I was all head deep into this project, which was what became Zap Surgical. So again, it was lying to myself that enabled me to get back on the horse. And so, I've done 3 startups. Every time I lie to myself, I tell myself, it's not going to be that bad. It's not going to be that bad. This guy's going to help me, or she's going to help me, or this right team. No, it's always bad. It's always difficult. It's always miserable. And we're going to talk about the valley of death. And I said, what valley of death? Which week are we talking about? So most entrepreneurs, they come to me and they look for inspiration. And my first instinct is to talk them out of the idea. Unless you're a glutton for punishment, you don't do it. And yet some of us, that's our destiny. You have no choice. So entrepreneurship is about destiny. It's not about brains. So.
Yeah, there's so many nuggets of wisdom there, right? I'm still processing. But yeah, big companies are constitutionally not ready to do innovation.
And we know that. You know that.
Yeah, I do.
Time after time.
No.
I mean,
Yeah. Point taken.
they'll piss away a lot of money in proving it too.
Yeah, I think okay, I shouldn't say something. So, okay.
It's a 4-letter word. By the way, epic is only 1 letter separate from the most vile 4-letter word in modern healthcare today in America. You may want to rebrand yourself. Where's Judy Faulkner?
She's sitting wealthy somewhere.
I know.
So, Neda, does that resonate with you?
Oh, absolutely. My journey has been always in large companies. I have launched 65 products for top S&P 10 healthcare companies, health tech and health bio, 6 platforms. And I have a living proof of what John is mentioning, that we spent hours and hours and days. We planned about the plan, and we planned the plan. And anytime innovation came to our desk, we sent it back because it was not planning time. And by the time we decided we want to put a budget for it, the market was gone to the next level. So in fact, a lot of these companies, they make their name not because they're the first. They make their name because they can buy someone who was the first, and they can build based on that. A lot of those VPs spend hours and hours to talk about someone else's innovation. So yes, they are institutionally not designed to do innovation, especially disruptive innovation, because also the ability to maneuver as an operator in large companies are limited, because sometimes as an entrepreneur, like I will do in the CEO role, I'll do a lot of different things to just make it happen, because we constantly have to reiterate. We respond to market reaction. We respond to customers' need. We build. We go back to the drawing board if the customer says there's a certain feature we don't like. I never was able to do that in a large company. If the feature was not liked, they had to go to next sprint, and the next sprint will sprint it for the next sprint. It was impossible. So,
and I also, actually, I agree with a lot of it. And what I also noticed is unlearning is probably even more difficult than learning. So, and these big companies have these memories that are filled with, this is how we do something. And that openness to do it different, new, better, may or may not be there. So I think that whole inertia comes into play is what I'm hearing. All right. So what do you have to say to?
I probably shouldn't share this. So, I mean, this is before, so sort of when I was just starting. I wouldn't say this now, but I think this kind of resonates with what John said, so I want to put it out. So there is, I have a definition for a startup. Please don't take me seriously. So there are, there are 3 stages to a startup. The stage 1 is delusion. Stage 2 is, delusion, illusion, and solution. So these are the 3 stages. So delusion, you fool yourself. Illusion, you fool your team and the investors. And solution, you fool the customer. But please don't take me too seriously. So, but I have never been in a big company. In fact, I have never worked for a company in my life. The only kind of, my journey has been through universities, through academic research. And so this is the first company I'm part of. And
universities are big companies too.
They
are every bit as stupid, I will submit. So, I mean, if you want to do real clinical innovation in the university, I believe it's impossible today. Anyway, sorry to interrupt.
So, agreed. I can't disagree with that. So my sort of, one bit of learning from my 3 years as an entrepreneur, being on the sort of side of management in some sense, right? So I am an innovator. At the same time, I have a team, so I'm also a manager. And one thing I realized is that innovation happens when no one is looking. It happens in the shadows. It's sort of, when you have audits, when you have processes, it's, completely by what, Reza was saying. So somehow I have had to fight this battle where, I have a board, I'm answerable to a board. And so, I have to create a certain culture. I have to make sure those audits are happening. I have to make sure there's transparency. At the same time, I have to cheat a little in the sense that I find my own sort of side projects, side hustle. I let people on my team, I give them that rope and say, just go do your thing and, don't tell me what you're doing. And I mean, I'm still struggling with that because I find that, very creative people come up with something, you start looking at them, it just, it vanishes. I don't know. It's hard to explain. Yeah.
I can add more to the value of that for startups. When you're in large companies and you're launching product lines and bringing new innovation to the market, value of that is usually the time that early adopters already purchase your product, and there is a need for a bigger push or something to change before you hit the next customer segment. For the startup, this trend reverses because you have to have the technology moat, you have to have the clinical validation and validity You have to have the right team in place and all of that. But if you're not financed enough for that stage that you're trying to push across, that is the valley of death for a lot of startups. And the reason we are all talking about bad days or waking up or like resilience is sometimes the startups have a hard time from the time they have the technology until they get to the market to secure enough confidence in what they're doing. And that's end of the story for a lot of these great innovative technologies. And I want to put it out there because I see the investment community has to take responsibility for that, because a lot of them come say, once you're de-risked, come back to me. And my question is, why do I need them? There was a Series C investor that said, I will only invest if they have between 10 to 100 million revenue, profitable. And I was thinking, how stupid is that CEO that comes to you? So, we have to ask ourselves, each person, what is it that they'd be good at? The startups, the entrepreneurs, we wake up every morning telling ourselves, this is going to be a great day. I'm going to change how things are. I'm going to pass the valley of death. But there is everyone in this ecosystem has a role to play. And I feel sometimes we don't talk about it enough. My CEO friend wrote an article in Forbes, and he was so embarrassed to say what he wrote about the investment community that he does not even share it with anyone. I found it on Forbes and send a message to him. And that's what we need to be talking about.
Good. So, this whole conversation about the board reminds me and emphasizes the need, either in the board or in the scientific advisory board, you really need people who understand some level of complexity that you are actually dealing with. So, yeah. Mickey, that's a secret to you now, having heard all this.
I have to throw all my notes away, by the way.
That's a good sign.
You did go off script.
That's what Eisenhower said.
Exactly. Well, I was thinking about this whole issue too, because I'm seeing this a great deal right now with exactly what you're talking about, where there's a different expectation for where the startup should be today than there was before. So I specialize mostly in diagnostics, and what our model used to be is that a startup would get enough money to usually get to early part of the market, not much revenue, but they've demonstrated a desire to use the product. And then, a large diagnostic company, for instance, would then come in and take it. And the skill sets were completely different, because oftentimes with diagnostics in the early phases, you're selling to physicians. You're not selling to laboratories. The big diagnostics laboratories, except the ones that sell in point of care, they sell to the laboratories. The different sell, I actually had a situation once when I was at the company Chiron. We had been bought by a much larger company, and I had developed with my group an assay for breast cancer that was better than our competition. Our salespeople could only sell to laboratories, all right? So I showed them we had a number of samples where we knew clinically that these women had breast cancer, but the other product didn't pick it up. And I said, isn't this great? They said, oh my God, we can't sell that. I said, why? This is because the way we sell, we go and we say, look, ours is the same as theirs, ours is cheaper. I said, well, what if it's better? That's a sell to doctors. We don't talk to doctors.
Wow.
And I literally, 2 years later, had to redesign the assay so it matched the competition. And then I left. So, I mean, this is the difference between the large companies and the small is so great that we have a new valley of death now, because the people don't want to invest you to get across that to a point where they used to take it on. Now, how are you going to get there? How are you going to get to the place where the strategic partner will take it on and carry it the rest of the way? Very tough, as you know.
As we know.
All right. So in the last 5 minutes, let's one advice to the entrepreneurs in diagnostics and devices, other than don't become an entrepreneur.
After they refuse to listen to you, what do you say next?
It's a question for me.
Yes.
Don't do it. Don't be. Ignore what he just said. Well, we all have our destiny. And if you really want to change the world, you're not going to go work for a big company. You're going to be stupid enough to do a startup that you believe in. And if you end up dying in failure, you gave it your best shot, and and I will be proud of you. I'll say you're stupid. I will say you're stupid, but you will have my undying pride. That's all I can give you. And just maybe you'll succeed and you'll change the world.
All right. Yeah. So I think,
Sounds like a white
yeah.
guy.
Neda, do you have a word of advice for?
Well, I'm curious to know what portion of this audience is entrepreneur, what portion works for large companies. Entrepreneurs, raise your hand. Okay. Okay, you have a big
Coming for
group,
large companies.
a lot more. Raise your hands. I know some of you are not raising your hands.
You can all quit today.
Right, right. I mean, it is very difficult to have a word of advice, honestly. Each one of us are dealing with different situation scenarios. But what I would say is, if you're passionate about what you're doing, and if you're stupid enough that you're doing what you're doing,
Yep.
and you have resilience, every day think about what is the good, right thing you do that day, and get through the day. Trust me, in long run, it will pay off.
Cool. Yes, Manoj.
Yeah, I mean, I don't know if I should be giving advice to entrepreneurs here. I'm still early in my journey here.
But lesson learned so far.
Sure. So lesson learned for me, I think so. I resonate with something again, that John put out, which is, so there is this samurai technique where, every morning that a samurai wakes up, in gruesome detail, the samurai imagines their own murder. And so I think it's good for equanimity, right? You kind of think through
Can't be worse than that.
it can't be worse than that, right? So you think through the worst cases and you make your peace with the worst that can happen, right? And then you say, there is still something worth doing here, right? So it's like, what should we chase in life, right? And for me, we don't chase happiness, right? I mean, what's the point of happiness? There are sort of cheap ways to get happiness, right? So what do you really chase? No, I mean, you have to figure out what you really want in life, right? So you have to find something worth suffering for. I think that's important.
I agree.
And so in some sense, when you find that thing, right, you know that there is going to be struggle, and so you have to imagine the worst. I think it's about mental preparedness. You imagine what can happen, right? The worst that can happen, and you go along for the journey, right? You kind of step in and then you take it
Awesome.
where it goes.
Well, I know Elizabeth Holmes, so I'm familiar with what's the worst possible thing that can happen. She was a
Yeah.
good storyteller, too.
She was used.
I did diligence on Theranos for the VC, and it was a remarkable adventure. I guess I would say, it's an old saying I like very much. The wise person learns from the mistakes of others. The fool learns from their own. I wish someone told me that 30 years ago. Go on and do something new that's stupid, not what everybody else did. Really study what the others have done and not done well.
I would also add surround yourself with a good group of people, strong group of board of director, very good investors, just bend backward to get the good ones on your team, good team members. I would say that makes it.
I think that's a great note to end at, because, yeah, I mean, I fully agree with the different things being said, but ultimately it comes down to people. And when you don't guarantee outcomes, make the journey as meaningful as possible, and having good people around you does make that possible. So on that note, let's end, and I hope you guys have time to chat with them and learn from them. All right.
Thank you.
Thank you.